Can I ask for your first and last name? Anna Perry. Perfect. And I'm just going to check your wrist here. Perfect. And can you let me know your date of birth? Awesome. Perfect. That is great. Thank you very much. So I'm going to be doing a IV antibiotic for you. So have you ever had an IV antibiotic? Yeah, you have? Okay. So you kind of know the procedure a little bit here. I'm just going to put the IV tubing on here so I know when that was done. All right. So Anna, I'm just going to assess your IV site. How are you feeling? You're doing good? Okay, perfect. So right now I am assessing for redness, swelling, anything that shouldn't be present. If there's like a little hard ball, it could be a blood clot, so I would definitely make sure to note that and let the RN or physician know. So everything looks good. Awesome. So what I'm going to do is I'm just going to perform hand hygiene again. And all right. Okay, I'm going to put some gloves on. All right. Once I have my gloves on, I'm going to clean. I'm just going to get in here real nice and close and personal, Anna. And let me know if you're uncomfortable at all. I'm going to throw this away because I'm going to let your bed up. Let me know if you feel uncomfortable at all. All right. I'm going to get this to about wrist height. I know the bed bricks are safe, rails are up, bed was down when I came in. All right. So then I would put gloves on after I did that. So now I'm going to clean the site where I'm going to be doing the IV flush. So again for 15 seconds and then let dry. All right, so I've got this here. So I'm going to undo it. This is sterile. Coming in, I'm going to make sure that the IV thing is clamped, which it is. I'm going to unclamp it. I'm going to push about 2 to 3 milliliters of water in, as our Harry Potter book said so, or whatever it was, whatever name of the book was. So about 2 to 3 milliliters. Alrighty. And I'm going to clamp it while I was pushing. Okay. For the sake of the video, I'm going to keep this safe. Okay, so now I know that it's been flushed, and this is bad practice. This should have been hanging up before I came in. So I would redo the tubing if it was on the ground. Anyways, so now I'm going to make sure this is all clamped off, that this is clamped, and I'm going to clean the site again. For the sake of the video, I'm just going to demonstrate, clean for 15 seconds. This is sterile, so I don't have to clean this port. I'm going to stick her in. This is clamped. I'm going to unclamp it now, and I'm going to get the drip right. So we don't have any watches on us, so we're going to be using the room cloth. So I've unclamped this now, and this is clamped, so I'm just going to let this start going. Okay, so I'm going to start looking now. Okay, and I guessed good because that was exactly 34 drops per minute. All right, so now that I know that this is going, this would be hanging more properly, but I would not step over this, by the way. So now I know I can hang my line. I'm gonna hang it here. Alrighty, and I'd make sure that this would be facing me, so if I ever walked into the room, I knew what medication it was. So I'm now going to clean this site here. Again, for the sake of the video, I'm not going to, but for 15 seconds, let dry. And then I can undo this. This is sterile. I would put it, oops, shoot. I'd make sure, oh my gosh, a little shaky, sorry. So this is clamped right now. So once I let this unclamped, it should take over the drip rate of this. In an actual hospital setting, I would wait another minute and make sure that this is at 34 drops per minute. For the sake of the video and the time, I know that I did the drop rate for this. I showed you I knew how, so that's all good. So, I would never do this, by the way. I just don't have a lot of room in my area. So now I'm gonna put the bed rails up, make sure she's feeling okay. Keeping an eye on the site, I would just assess it for a little longer. Take my gloves off, perform hand hygiene again. Lower the bed. How are you feeling, Anna? You're doing good? I'm glad. Okay. I will be back in about 25 minutes to check over your medication again. Ring the call bell. You've got it beside you if you have any worries or anything, and I will just be outside. I will see you later.